This is a demonstration of how to prevent pressure ulcers on a patient that is bed-bound. There are many devices that you can use to provide pressure ulcer prevention. One of them is a foot drop boot where you apply to the patient, and it prevents the foot from having foot drop, and then also it protects the heels. And here's another version of a foot drop boot. This can be used mostly on the foot, but some places they can also apply to the elbow to protect the elbow. This is a sheepskin, and you can apply this to the elbow or to the heels. And this is also another version of a sheepskin where you can apply to the elbow or to the heels. I will apply to my patient so I can demonstrate the proper application of it. One more device I would like to show you is a bed cradle. This is placed on a bed, so the sheet goes over the bed cradle, and it protects the patient's toes from getting the pressure from the sheets over it. Let me uncover the patient. Always remember your beginning procedures. So you come to the patient's room, you will knock at the door, make sure you have all your equipment in hand, wash your hands. You will walk in the room and you will introduce yourself, and also make sure that you have the right patient. And if there are any visitors, you will ask your visitors to leave. Okay? So I'm going to come here and say, "Hi, John. I'm Marta. I'll be your nurse today, and I just need to apply some pressure ulcer prevention devices on you." The first thing I need to do is to lift my bed. Always make sure that you are safe, you protect your back, and that you maintain the side rails on for patient protection. Okay, so you will raise the bed to a comfortable working height. Okay. You should always keep your patient covered, keep the curtains on, and provide as much privacy as possible. For the purpose of this presentation, I will uncover the patient so you can see how it's properly applied. For this type of a boot, you will place the patient's foot inside. And we'll strap the boots on. You will make sure that it fits nice and snug, that it's not cutting any circulation, and that mostly it's comfortable for the patient. Make sure that you assess the patient at least every 2 hours. With this other device, the idea is basically the same. You will just place the patient's foot in, and you will just put the Velcro around. And again, the foot is on a dorsal flex position, so it's avoiding foot drop, and it's also protecting the heels. When using the sheepskin, this is a lighter device, so it's for a lot of patients it might be a little more comfortable. However, this type of device will not prevent the patient from foot drop. It will just protect the heels from pressure. So this is how it's applied. The next device I would like to show you how to apply to the bed is the bed cradle. And like I said before, this will prevent pressure on the toes. So the first thing you need to do is to undo the foot of the bed. You will then lift the mattress, and you will insert this over the mattress. Once it's placed in there, you will place the blankets over the bed cradle. And it will kind of form a tent over the toes. This will prevent the pressure. And for patients that are diabetic, this is very helpful because it will protect their toes at all times. To remove it, you just have to raise the mattress and then just take it off. This other device here, it would probably more adequate for the elbow. So let me just cover my patient here. You place the patient's elbow inside of the sheepskin, and then you just strap the Velcro around. And this way the patient still has plenty of flexibility to move his arms, but at the same time his elbow is protected. And again, since this is a bony prominence, you want to make sure you assess every 2 hours at least. And other ways that you can provide pressure ulcer prevention is making sure that your patient is always clean and that they have good nutrition, that you reposition them at least every 2 hours. And whenever you are showering your patient or you're repositioning, check for all the pressure points, which should be the back of the head, the shoulder blades, the elbows, the coccyx, and the heels. Okay, and always listen to your patient. If your patient will complain that their heels hurt or their elbows hurt, you want to assess, identify, and make sure you report to the nurse.